guys, so I have Megan Frickel with me here today. Megan is a pelvic floor physical therapist at Sandhills Physical Therapy. I asked her to come in today to educate our clients and our fans just about pelvic floor physical therapy. I think there's a stigma that pelvic floor physical therapy is only for maybe pregnant and postpartum women or elderly, but it actually affects a lot of people, including like high impact athletes. So I'm gonna ask her a few questions. And then feel free to reach out to either one of us after this video goes out if you guys have more questions. Are you ready?
Ready.
Okay. Okay, so briefly describe the services and treatments you guys offer at Sandhills and what populations might be affected by those.
Okay, so as physical therapists, we always focus on musculoskeletal disorders, and pelvic floor physical therapy is no different, even though we do interact with the organs more than any of our other counterparts for the most part. We treat with basically the same types of things, just adjusted for the pelvic floor. So anywhere from strengthening to pressure management, postural re-education, manual therapy modalities, depending on what the symptoms are. And we can treat from potty training to death pretty much. And even sometimes before, if there's a constipation issue in a baby, we can even work on some of that.
So literally any age?
Any age, yep.
Okay.
Yep.
Okay, cool. So I've actually been seeing Megan for like an overactive, like a super tight pelvic floor, which I think a lot of women that lift have that problem. Would you agree? So I started seeing you sometime in my second trimester, maybe towards the end of my third. When do you recommend that pregnant women come see you?
Literally anytime.
Okay.
You can come right away. It just depends on what your symptoms are and what your concerns are. If you have a lot of pain or leaking or instability, or now you can't lift what you could lift before and you're not sure how to grade it, we can work on that at any point during the pregnancy. I've seen patients throughout their pregnancy where we were treating before they got pregnant and up until delivery, or whatever we need. But if you have anything during your pregnancy that doesn't feel right, probably isn't right, and so we can look into it and figure it out. And if you have a completely uneventful pregnancy and you're doing great, there's still stuff we can do to prepare for birth and kind of educate you on what's coming, because your body goes through a lot for 9 months, and then they just give you a baby and send you home and tell you good luck.
Yeah, that's a good point. So then Megan has also gone over just like different positions, how to like breathe, inhale, exhale, when to push, like just stuff like that. Okay, so then what about postpartum? When should women come see you postpartum?
As soon as an issue arises, you can come in before the 6-week mark. It doesn't require, you don't have to be released to come in. If you are having issues with back pain because of feeding, you're holding the baby one way, now your neck hurts, any of that can be adjusted and addressed in physical therapy. Feeding issues, we even do offer treatment for plugged ducts for breastfeeding moms.
So
yeah, so and it can be really effective. I treated myself for that when I was nursing Bridger last time. And at any point, really, if you're not feeling right, then come in. We can talk. And I have years of experience. I know when to push and when not to. So
okay, good.
Yeah.
Okay, so that kind of leads me to my last question then. So like give us a few symptoms that people might say, oh, like I guess I didn't realize I need to maybe go see a pelvic floor physical therapist. You've already named some, so like back pain, trouble with breastfeeding,
incontinence, constipation, pain with sex, pain with anything really. If you have pain, that's an indicator your body's trying to tell you something is wrong. Doesn't mean that something is damaged, just something's not working right. And so that's something where we can kind of try to figure out what that cause is. But pain, a lot of people will just say, well, my sciatic is really bad, but I'm pregnant. Like, well, that's nonsense. We can try and get it better. There's no reason that you can't do stuff when you're pregnant. As most of your pregnant clients will know, like, you want to do everything you can. I ran until I was 39 weeks pregnant. Like, it's all possible. So if you can't do something and you're not sure how to grade it, or you want to keep going but you don't want to overdo it, then that's where we can help with that guidance on what's safe exercise wise, when to push, when not to push, as far as your training routine as well.
So like as a coach, I would prefer a pregnant or a postpartum athlete to come consult you first
Sure.
before they start doing any kind of training with us. I would just like your clearance first.
Right. And we do have a very specific, we're doing more research all the time on like weightlifting athletes, but we have a lot with running athletes and looking at the like the musculoskeletal healing process, especially when it comes to impact. And a lot of this is easily translated, just like we do with the running clients. You can go through, I go through a simple screening. We've done it. You go through, how's the pelvic floor muscle functioning? Do you have pain? Do you have tightness? How's your sleep? How's your anxiety, postpartum depression, any of that? How's the baby feeding going? Are you nursing? Are you not? And if you pass that screen, we can move into like a strength screen, and we can very like generally get a picture of what your lower extremity and pelvic floor strength is.
Okay.
And if you pass that, then we move into impact readiness. Now, with that, I typically don't start impact readiness until 12 weeks postpartum.
Okay.
A lot of doctors will give you the go-ahead at 6 weeks, but I mean, if you've ever been injured, you know doing nothing for 6 weeks and then going full force is not good.
Yeah.
This is not any different. Your muscles are injured with the process of pregnancy and the quick, changes after birth. And so any time in there we can start the process, but I usually don't do impact readiness until 12 weeks. But that doesn't mean that you can't be walking, you can't be doing all these other things.
Yeah.
You just don't want to go heavy until a little later.
I think a lot of women hear that the go ahead at 6 weeks, and they think that means like green light, go. But that really probably means like red light, like start rebuilding slowly, right?
Yeah, totally. And I think that that's something that's not as well educated to people because, it's been years and years of having babies and, they're okay, you're good to go. And unfortunately, we do more and ask more of our bodies now than we ever did. And I mean, maybe my mom did jazzercise, and I don't know how soon she went back after having us, but I would hope not at 6 weeks because she probably wasn't ready.
Yeah, for sure.